Thank you very much for the kind introduction, Lord Hunt. It is always a big pleasure to come to the UK and to learn the new things which have developed here and to carry the message also to other countries. So, first of all, a big thank you and to you and you, Glenn, for the invitation to have me here again. And I would like, as Philip just said, to talk a little bit about something which is so important for all of us, vaccination. It is a delight on the one side to see so many of you face to face. I must admit, it's also a little bit frightening to be in such a big group, for me the first time, really that I'm back traveling to a conference and being with so many people in one room, and like you, and getting in some heels again, right? So that's really the difference. And if you are looking back, it's now really a little bit more than 2 years that WHO declared that we have a global pandemic, which has caused incredibly suffering. We should never forget that we see already over 6 million deaf people. And if you think of the families which are behind it, this is an incredibly number of people across the world which have been affected by this. I had to update my numbers because still I'm afraid we are not over it yet. This is still ongoing. Numbers are still increasing. We seem to be perhaps over the hill and over the worst, but we have over 460 million infections worldwide. But we have also billions of vaccines administered. In a unique effort, really, across the world, cooperation happened as we have never seen it before, developed and administered. And the UK was really at the forefront, I must say that, really. But our world has changed, and I think never healthcare has been so important as it's now for all of us. I think never vaccines, treatments, masks, tests have been discussed at dinner tables across the world so much, and everybody has gotten a little healthcare expert, right? Because suddenly all of us were affected so much. The pandemic had a huge impact, really specifically on those who have treated patients, on the hospitals and the caregivers. And I want really not to forget what incredible strain it has been and is for all of those, and I address also those of you here who are working in hospitals. It has been an incredible amount of work, time, pain, really also to you who are treating the patients to go through this. And I'm the proud and sometimes also anxious mother of a doctor in the NHS there for you on the left side. And I must say it's taking the toll from everybody. And I know that you don't want clapping anymore, but I want to say that the world is really owing you a lot. We are very thankful, and you have our deepest respect, really, for everything which you have done in this time and are still doing. But we have also recognized that it's a global problem which we need to address. The vaccines really needed to be distributed globally. COVID-19 is not stopping at borders. It affected really everybody of us. And for the first time, really, we needed to have a global collaboration. We needed global supply chains. We needed interoperability, and not only in the NHS systems, but also across the world, because really regulatory bodies, vaccine manufacturers, everybody needed to work together. And global standards, as really the global language of business, are playing an incredible important role here. We have talked also about the digital transition. I think that was perhaps one of the positive things of COVID. We have been propelled forward. Never would I have thought that in 2 years so much would have happened with regards to digital transition into a next generation. And again here, our standards, our keys are playing an essential role when we talk about digital transformation, if we want to really go digital. It's not only standards alone. GS1 had the honor to be the chair of the JIC, the Joint Initiative Council, which is a group of standard organizations working together, committed to interoperability. All together, we can make it happen. And we need also the solution partners really for that. Don't forget those who are standing in the hall next to you. They are the ones which systems need to carry the global standards. Otherwise, really, this will not happen and we will not see interoperability. Trust and supply chains was something which got a really important role, and Hanno will talk much more about that after me. But critical questions which we all asked were, where are vaccines? How can we get them to the patients? How can we get patients vaccinated? But also very quickly, unfortunately, where have they been and are these the real vaccines? Before the FDA approved the first COVID-19 vaccines, we had already fake vaccines in Latin America on the market, incredibly. But counterfeiting is a big business, and people were very, very quick in bringing fake vaccines, fake masks, fake tests onto the market. This is a real threat to patient safety. Then expiration dates. My colleague Siobhan will tell you later how expiry dates are changing when you are changing where you store the vaccines, when you take them out of the fridge. So are they still effective? A topic which has really gotten important with vaccines. And last not least, and we have touched on that, who got the vaccines, when and where? I must say I personally was so disappointed when I live in Belgium, when I got my first vaccines and somebody started to write down the lot number and everything and handed me this handwritten little card. I thought that's really, I mean, for somebody in my position, you can imagine I was really disappointed. And it didn't help that, yes, sometimes later I could download my app and then this number was in there because I knew somebody had manually typed that in. And we know at GS1 that mistakes are happening when you transfer data manually. The next vaccine I got had already the little data metrics, at least on the sticker, but I can assume safely, I think that still the data have been transferred in a manual way. So why do we not have really scanning also implemented for vaccines, where it's so super important that we know who has gotten which vaccines? Relatively new products, which I fully trust, but nevertheless, we might need to find patients back after some time, and then it will be a real manual process largely. So visibility and traceability has been something which has been really in the focus of a lot of people during this time of the pandemic. This probably has also caused regulatory bodies to look more at that, and WHO published last year in April a policy paper on traceability. And WHO is normally very careful with pointing out one organization or one specific standard. But in this paper, for the first time, they really acknowledged the importance of global standards to enable traceability in a paper which is really important for all their member states. And you can see here from the report the GS1 standards that are currently the global family of standards in wide use globally for pharmaceuticals. And you see the data metrics with the 4 data elements, which we try really to implement across the world, which is largely implemented across the world for the identification of pharmaceuticals. Not long after that, in August, the ICMRA, a group of regulatory bodies, including also the WHO and healthcare stakeholders, developed some recommendation on the technical side of implementing traceability systems, allowing interoperability. Again, a really great endorsement for GS1. GS1 standards are the most widely accepted and adopted international data standard for pharmaceutical identification, coding, and data exchange. So one of the positive things that really COVID also pushed the need for global alignment really forward. And I think in the meantime, everybody knows Dr. Seth Berkley, the CEO of Gavi, because he has been in the headlines over the last 2 years so much. I must say he was one of the visionaries already a time ago. In 2016, he already pointed out in a TED Talk that barcodes should be a really good tool to enable traceability of vaccines. At that time, there was not this urgent need, but now, with COVID-19, things have moved forward. And you can see here last year in a Deloitte paper, a quote where he clearly said that we need to trace every vaccine dose, and we should do it with the 2D data metrics, and adoption of common standards across the world are really necessary. This has driven probably also then the decision of COVAX, Gavi, and UNICEF to ask for GS1 standards, to ask for barcoding for all vaccines. And that is really making change happen. We had in the session before the questions, can we get manufacturers to do barcoding? Yes, you can, you have the power. I have seen really Chinese manufacturers who so far used only a specific national Chinese code. They are now changing to GS1 standards because they want to sell to UNICEF, they want to sell to COVAX, they want to sell their products across the world, and such kind of requirements are making change happen. You see here they are asking specifically for the GTN, the GS1 product identifier, the lot number, and the expiry date. And for COVID-19 vaccines, they ask also for serialization for a very specific reason. Because we see in many low and middle-income countries that counterfeiting is a very serious issue. So UNICEF, COVAX, Gavi, World Bank, and others have decided to realize the vision of a global trust repository, a central place where manufacturers will feed data into, and from there, UNICEF will give this data to governments in LMIC countries in Africa. For those countries which have already started to enable traceability, like Ethiopia, like Nigeria and others, they will provide the master data and the serialization data to them, and with that feed their traceability system. For other countries, they will enable, in a similar way as in Europe, an authentication system. And that is really starting now, this activity, and it's based absolutely on GS1 standards, on GS1 identification standards, and as you can see here on the slides, which is from UNICEF, also on EPCS, which is a GS1 standard for sharing data when a product is going through the supply chain. So change is really happening also in countries in Africa and Asia Pacific, etc., who need it. We have some great implementation showing the benefits, and my colleague Siobhan is here. Siobhan, if you raise your hand. In Ireland, a fantastic work of GS1 Ireland, together with the regulatory authorities there, has shown really implementation of traceability down to the dose, down to the patient. And this afternoon, Siobhan will talk about that. So I really invite you to listen to this case, which for me is really a best case example, what can be done. And I challenge everybody, why are you not doing this everywhere across the world? Australia, and my colleague Cass is also here. And if you have an opportunity, talk to her, because also there, our keys, the GTN, the GLN, has been used really for traceability of COVID vaccination, but also for the identification of location of people. So please talk to Cass about what they have done. And I wanted to mention also Turkey. Turkey was one of the countries which was the first really to enable full traceability. Of course, they have rolled that also out for vaccines, and they are really able to see which patient has gotten which vaccine, who needs to come in for a next dose, how much vaccines do we have available. So this can be done, so we should do it really for the benefit of everybody. So to summarize really, the global pandemic has been very challenging, has brought a lot of sorrow, and also propelled things forward, as has shown us that we need collaboration, that we need interoperability, and we need trust in our supply chain. We need to be sure that products are where they are needed. We have a very global supply chain, and for that, we really need global standards. And our standards are really an enabler for them. So please use the opportunities which are lying there, because what works for vaccines works also for any other product, works for other pharmaceuticals, works also for medical devices. Once systems are prepared, it works for everything. Thank you very much, and let's not forget, safer, more efficient care starts with a simple scan. Thank you very much.
Thank you very much, Ulrike. You've been such a champion of our work here that it's a real privilege to hear you speak. And I must say that what I've been impressed with is the global endorsements of GS1 standards from WHO, COVAX, UNICEF. Is really important for the future integrity of standards. So thank you very much indeed. And now Hanno Ronte is going to speak. Hanno.
Well, thank you, and good afternoon, and what a hard act to follow. But in many ways, I think what I want to do is maybe two contradictory things. One is to broaden the discussion around standards into trust, but also deepen them by giving a few notes on how we have experienced this in vaccines. And I'm Hanno, I'm a partner at Deloitte and have worked both in the public sector, both with charities as well as with manufacturers, and sort of feel I've got we as an organization have a bit of a view of how the collaboration and as a result the trust that is needed has come together. So let's maybe just start with a very simple question. What is trust and why does it matter? And why do standards play a role in trust? So for those of you who've traveled here by car today, you will rely on standards. You hope that in the UK everybody drives on the left. You know, in Germany, driving on the right. You know, if you do that there, that's a standard. We also trust each other in the sense that we hope that at least not many people here are knowingly infected with COVID as they sit here close to each other. And those are all elements where we trust each other. But the question then is, for health, why does it matter? Well, it matters because we want to trust our public health advice. We want to trust that the medicines that we take are the right medicines, that they work, that they're safe, that they're not expired, and that we can get the benefits that are promised. And so we need to think about how we really think about trust that is generated as a system that we can manage. And our very simple view is that trust is based on competence. You have to know what you're doing. You have to really be capable, and you have to demonstrate that in a reliable and consistent manner. And that reliable and consistent manner in particular is embodied by standards. And I will come back onto that in a minute. But it is also about the intent. It is about demonstrating that you have the right way of approaching it. There's a sort of, the word that we use is sort of humanity, that you really want to try and do the best. And even within vaccines, we know that there are the dark sides of that, from fakes to the darknet selling vaccines at sort of $500 when they were very rare. That's probably not the right human intent. And it is also that you see for the first time in this last year that pharmaceutical manufacturers, their CEOs have become sort of cover people, spokespeople for individual products. That has never really happened in the last 30 years, unless you go as far back as sort of Tylenol scandals and J&J when things really went wrong. But it is therefore also about transparency. and how clear are you in doing and saying what is going to happen. And that's where, again, standards create a level set, a standard, a way of communicating in a transparent way that really matters. So let's leave the theory and have a look at how this has affected vaccines. We've made a lot of progress over the last year. You know, if you think about how standards help to create vaccines in record time, you know, we had initially 1, then 2, now we probably have 10 on average, all of them with different types of characteristics. But we relied on the standards set by regulators that they meet safety and efficacy standards. And I think that's really important, in particular, as Ulrike mentioned, and I'm sure you have as well, you have a lot of friends who suddenly became experts in clinical trials with, saying why one efficacy is sort of slightly better. And actually, the interesting thing about this is that it has also created challenges, because we have now people saying, well, what is the best vaccine? How can the standards tell me what the best and the only one is? And that is actually where public health doctors become really instrumental. Some countries have simply solved it through availability. There is no best, there's simply what's available. And in some cases, you may have actually seen a bit of choice. The other thing that we have done really well is we have built a traceability system around the GTIN number. That has been a tremendous success. I mean, I still marvel at the fact that after having had the little paper with the batch number on it, that actually it is in an app 2 days later, including the batch number. Who would have thought that I would ever be interested in a batch number of a vaccine? But that is what we have gotten to. But the challenge is not universal. So, because we've seen in African countries, for example, the GTIN number works, but the collaboration and the visibility and the transparency falls at the last hurdle. So we have come across situations where the data simply wasn't shared because they haven't got the compatible version number of Excel. You know, this is sort of very basic things where a great system that works 90% of the time just falls apart at the last mile. But that is a real great sense of achievement. The third thing that we have done very well is, well, we've vaccinated about 60% of the world population has at least one vaccine, but the last hurdle, the last bit, is difficult. We know that there are big differences between rural and urban areas. We know that there are differences in ethnic minorities, usually about 15-20% from the national vaccination rate. And the challenge is, how do you do the last mile? And that is no more acute than in less developed countries, in particular in Africa, where we've seen examples of, in Kenya, for example, people using flying doctors to really deal with that last mile. But we've also seen the challenges about how do you really build the trust to take it. You know, it is still, despite the regulatory, despite lots of people agreeing that it is the right thing to do to take the vaccine, we have seen this continued difficulty about getting the trust embedded to take or be vaccinated. And some of that is historical reasons, in particular for ethnic minorities. Sometimes it's political, sometimes it's purely personal. But I think that gap, remains. But the trust agenda is also highly visible in terms of how we even communicate about it. So like Ulrike, I'm German, but if you go to the Christmas market in Germany last year, when you wanted to buy a sausage and chips, you had to say whether you had been vaccinated. So that's the first level of mistrust. So you simply say yes. But then he says, well, I don't trust you. Can you show me your certificate? So you scramble out your phone and show the certificate. And they don't trust that either, because they then say, can you show that it is you? So can you demonstrate that you have a passport or a personal identification number or something to show you? So what I'm trying to illustrate is this of the sense of trust, even in terms of how we, through vaccinations, enable our communication, is really critical. But again, I think the NHS app saved me on numerous sausage buying trips over Christmas. But there's more to do. And I think the first is clearly being ready and being very clear about how we continue to collaborate. There will be another pandemic, and the vaccination products that have been made were probably the result of more than 300 partners collaborating for manufacturing, design, etc. And that requires a degree of trust and collaboration that we hope will be endemic, can maybe be institutionalized, and carried forward. I think the second is continued use of standards. I think Ulrike talked a lot about the challenge already about basic phones not being able to read the 2D barcode. That would be a tremendous improvement, in particular for less developed countries. And then building these trust repositories around the data will also help enormously to be ready. I think the third thing is to continue to drive that last mile, to really drive a better way of interacting with the local communities and finding a way of getting this habit that we have now of getting vaccinated more embedded. But I think there's also some really interesting lessons. We've been very creative also in the UK around delivering care in very different ways, which has built a different sense of trust around how care is delivered. And that, I think, can only, going back to the earlier presentation, actually deliver better care that costs less and is actually more effective, in particular the use of virtual consultations and more home care. And then the last thing that we still need to do much better at is find a better way of communicating. This is a better way of communicating for the benefits, in this case, of vaccines, but frankly, it's also of health. We've seen this enormous shift through the pandemic that actually wellness does matter, prevention does matter. If you're generally healthier, you will be better equipped to deal with illness. So how can we do that? Because not only is it better for the population, for you as an individual, but also for the costs of the health system. But we have seen that it is not just a one-trick pony. You cannot just have one person saying, this is the way forward. You need multiple levels. You need to engage the community. You need to engage national and supranational bodies like the WHO. And that will, in the end, fundamentally drive a difference. So I think this level of trust that we are building and have experienced through this, I think is a real asset and something that we shouldn't squander. Standards help embody that. And I think in many ways, it is, I think, yours, mine, and our responsibility to really build that trust by demonstrating competence and a real human intent to better equip us for the next pandemic, and frankly, to deliver the care that I hope to receive in 10 years' time when I really need it. Thank you very much.
Thanks very much, Hanno. Another very interesting discussion. So could my colleagues come up and we'll have another discussion. Thank you.